Hi, everybody. This is Dr. Chitra here, your mentor at StudyEFOG. And today we are going to see about risk management. So you are going to have a station in risk management, and there basically it would be about incident reporting or root cause analysis. So let us see how to do one incident reporting station first. And then afterwards, what is the difference between an incident report and what is like when you would be doing an incident reporting and when you would be doing a root cause analysis. Okay. So we have here with us Dipti, who has agreed to be the role player. So welcome, Dipti.
Thank you,
And
ma'am.
if you are ready, then let us start. All right. So the topic, as you can see, it is risk management. All right. So I will show you the role player instructions first, and then afterwards we will begin the station. All right. So, all right. So normally we begin all of our sessions by a very positive quote for all of you. So since exams are around the corner, and I think the best way to crack the exam is to practice, practice, and practice. Okay. So this would be like a typical thing that you would get for the candidate instructions. So remember here the scenarios are in this exam, scenarios are not very long. You have 1 minute to read the candidate instructions, and then you have 11 minutes for you to do the task. Okay, so here this scenario is about you are the senior doctor in the room, in the labor room, and one of the junior doctors had witnessed a vaginal birth being taken place. The midwife was conducting the delivery. She gave an appropriate episiotomy also, but after the baby was delivered, she noticed that the patient or the woman, she had delivered a 4th-degree perineal tear. And so then you have this junior doctor who actually wants to report this incident, but she really doesn't know how to do that. So that is why she has come to you for help. Okay. So Dipti, you can please unmute yourself. Are you ready?
Yes, ma'am.
All right. So let us begin. Okay.
Okay.
Sorry, this is not the marking system. I will show you a little bit later. All right. So Dipti, let us start.
Yeah, yes,
Okay.
ma'am.
Hi, Dipti.
Hi.
Hi. I'm Chitra, and can you tell me how I can help you today?
Hi, doctor. Can I call you Chitra?
Yeah, that's fine.
Yeah.
Definitely.
So I've joined as a junior doctor in our department. So everything seems very fine and everybody is very good in our department. And I have a problem with me. So yesterday I saw a vaginal delivery, and the nurse was giving an episiotomy. So I need to know and have to make an incident report to the senior doctor. So could you please help me in that?
Sure. Dipti, I think your video is paused. I can't see you.
Can can you see me now?
All right. Yeah, now I can see you. So surely, yes, Dipti, I would surely help you in that. So basically, this is something that you want to report. Okay, so an incident report is something like you have seen an incident that is happening. You know that this is something which is not normal and you want to report it. So the first thing that you have to understand is that you are not making a complaint against somebody. Okay, whenever you are making an incident report, it is basically because something wrong has taken place. Okay, and you want to report it so that there is a record of what has happened. Okay, so that if in future the patient or somebody wants to make a complaint, then there is a proper record of what has happened. All right, am I clear to you, Dipti?
Yes. Yes.
Yes. So you have to understand that it is a part of the learning process, because we want to improve care that we are giving to a patient, and we do not want the same thing to happen again. Okay. So understand the first thing, that this is not something that you are making a complaint against. It is just basically for documentation. All right. Now, how do you go about making this incident report? Okay, so in most of the hospitals, there will be a written form for it. There will be a ready-made pro forma, and you just have to fill in all the blanks. Okay.
Okay.
So you do not have to put in your personal comments like, I think this should have been done or that should have been done. That doesn't happen in an incident report. It is just a simple documentation of the facts that have taken place.
Okay.
Okay, Dipti, am I clear to you?
Yes,
Okay.
ma'am.
Okay. So basically, there are two forms. It is most of the times available on the web. Okay. Or maybe you can have a physical form. So you can go to the risk management team or the manager there, and you can ask him or her to give you the form and you can fill in the form. Okay. So there
Okay.
are two parts to this form. One is the form that you are going to fill as the incident reporter, and the second one is part B of the form is the person who is going to receive the form from you.
Okay.
Okay.
Yeah.
So in part A, what you are going to fill is basically your details because you are doing the incident reporting, right? So you have to write your name, what is your job in the department, okay, and if possible, if you have an ID or an identification number, you can also fill in that identification number. And most importantly, you have to write the date and the time when you are filling in the incident form. Okay, so that then
Okay.
your record is complete. Okay, so these are your details. Then the next is everything about the incident. So who was involved in the incident? You have to write the name of the patient, okay, or whoever was involved. Now, because we are talking about a patient, I am telling you to write the name of the patient or whoever is involved in the
Okay.
incident. You can write the name of that person. Then where exactly the incident has taken place. So now here, can you tell me where exactly the incident has taken place?
The labor room.
In the labor room. Correct. So in the obstetric and gynecologic department, in the labor room. Then you have to write the date and the time when the incident took place. Okay. And here, now besides the name of the patient, you will also write the name of the midwife who was conducting the delivery because she was also involved in the incident. Okay. Am I clear to you now?
Yeah. Yeah.
So now we have the name of the person who is making the incident. We have the name of the persons who were involved in the incident, the place where the incident happened, the date and the time.
Okay.
Okay. Now, can you tell me what you are going to write next?
When we can make an incident report?
Okay. So
Yeah.
basically the report or this incident report, you have to make it like once you have seen an incident, it's fresh in your mind, right? You
Okay.
remember exactly what has happened, please. So it is preferable that you make this incident report within 24 hours of the incident happening.
Okay.
Okay. So once you have filled in all the names and the dates and the place, everything has happened. Next is what you have to do is you have to write exactly what happened.
Okay.
Okay. So here what is happening? You are one of the doctors in the labor room, right? So you can say, I was working in the labor room or I was watching this midwife who was conducting the delivery of this lady, Mrs. So-and-so, whoever, whatever is her name. Okay, the lady was really pushing down very well, but the midwife thought that the baby is very big. And so she gave an episiotomy to deliver the baby. Okay. After the baby was delivered, what happened? The midwife noticed that the woman had sustained a fourth degree perineal tear. Okay. This is the incident that you want to report. Okay. Am I clear to you, Dipti?
Yeah. Yeah. Yeah.
Okay. So what I am trying to tell you basically that when you are doing an incident reporting, you do not have to put in your thoughts that maybe the midwife should have called a senior for help or she should have given a larger episiotomy or it was a difficult delivery, so someone else should have conducted the delivery. You don't have to put your inputs on that or what are your thought processes or what you are thinking. You only have to write whatever has taken place. Okay. And then after the incident happened, what happened? So the midwife, she realized that there is a 4-degree perineal tear. So she called one of the senior obstetricians to help her out. That is the end. Okay, that
Yeah.
is the end of the incident that has happened. Next, what you can do is you have to write your name, the time when you are making the incident report, and you have to sign.
Okay.
Okay. So now this incident report, or part A of the incident report, has been complete. Now the
Okay.
next part is you have to send it to the higher authorities, or you have to send it to the risk management team. So for that, if you are doing it online, you can just submit it online. If you have a physical paper, then you can go to the risk manager. Every hospital will be having a risk manager. You can go to the risk manager and you can tell him, I want to report an incident, and this is the incident report form. Okay. So what the risk manager will do is he will take the form from you. He will write his name on part B of the form. There will be a place for the risk manager to write his name, what time he has received the incident from you, and he will make a note of it. And then he will tell you, okay, we will see what is going to be done ahead. Okay. So
Yeah.
this is all about how you are going to make an incident report.
Okay.
Okay. Do you have any questions for me, Dipti?
No, so far no questions. Everything is clear.
Okay, thank you so much. So that is all that you have to do in an incident report. Now, if you want to still read further about it, I will give you some reading material, or I can give you links to a few videos where you can see how exactly the incident reporting is being done. Okay, and if you still
Okay.
have any queries, you can come back to me at any time.
Okay. Thank you so much.
Okay, yeah. Thank you so much, Dipti. So guys, this is how an incident report is done. And I hope I'm clear to all of you. Okay. Now, whenever you have an incident report to be done, okay. So the next part is, once you have finished it, then naturally you want to know how you are going to be marked for it, right? So let us see what is going to be the marking system. Okay. Just 1 minute. I will move my slide ahead and then we can see the marking system. Okay. So once we have done the incident reporting, you have done your task, then this is going to be the marking system. So remember, it is the marks are out of 20, and in that um, you will be basically assessed for your communication skills and the knowledge. Okay. So whatever is the knowledge area there, that is going to be evaluated by the examiner. Out of 10, it would be 3 marks, 0 to 3 for history taking. Then what is the need for an incident reporting? 1 mark for that. And how you are explaining in detail how to make an incident report. Okay, so that is how it is going to be. And for communication skills, 5 marks are going to be given by the examiner, and 5 marks are going to be given by the um, role player or the patient actor. Okay. So by the examiner, how you are introducing yourself, whether you're offering support, find out that everything good is in the department. Frequently, you are checking for understanding or not, and then when you asking for a feedback. Similarly, by the role player, or similarly. Okay, and then depending on how was the entire station, you would be marked accordingly. Okay. So now let us see how or what is the difference between uh, risk, like in risk management, the different stations that you have. Basically, one is an incident reporting, which we just saw, and the other is a root cause analysis. So what is a root cause analysis and what is an incident reporting. So incident reporting, we just saw that anybody who has witnessed an incident that is happening and that person thinks that this incident has to be reported, an incident reporting would be done. Now, depending on what is the grade of the incident, further things will happen. The risk management team will decide whether it is a near miss or it is a never event or it is a catastrophic event. And depending on what is the grading of the incident that has happened, it will be decided whether a root cause analysis has to be done or they can just go and talk to the individual who has been involved in the incident and see what can be done further. Okay. So basically a root cause analysis, it is a structured investigation process that aims to assist in the identification of the root or the underlying cause of a particular event or problem by determining why the failure occurred and the actions necessary to prevent or minimize the risk of recurrence, because we do not want near misses or never event or a catastrophic event to keep recurring. Okay, because that would not be in the best interest of the patient. Okay. So basically, first about incident reporting. It is basically because you want that all incidents that which should not have been occurring, they should be reported, they have to be recorded, and they have to be managed accordingly. So you have to ensure that sufficient information is obtained to meet internal and external reporting requirements. And because this is important to respond to complaints and litigations if these ensure. Okay. Now, what are the benefits? Understand that an incident reporting, it is not something because you want to complain against a particular person. It is to learn from the incident that has happened and to make sure that these mistakes are not repeated again. Okay. Also, it is to improve patient practice and patient care, to prevent recurrence and to reduce the claim or the cost of litigation. Okay. And it will also help to improve the trust or the hospital reputation. Now, how do you know that whether a particular incident needs reporting or not? So each hospital or each trust, they would be having a trigger list. And if this particular incident, you can see that it is there in the trigger list, then you can make an incident report. Okay. So what are the incidents that can be reported? You can have a near miss, like something bad was going to happen. You saw a nurse, she was about to give the wrong medicine to a particular patient, but she noticed it in time and she did not give that particular medicine to the patient. So this was something that nearly happened. The incident nearly happened. It did not. Or in the operation theater, the wrong side of the patient was going to be operated. Like a patient has come in for a cataract surgery. The cataract is there in the left eye, but the surgeon thought it is in the right eye and he was going to operate on the right eye. But in time, he realized his mistake and he corrected it. So that is something which is a near miss. Adverse incidents or clinical, it could be clinical or non-clinical. So the nurse, she gave the wrong dose of the medicine to the patient. So nothing happened to the patient, but something bad could have happened if she had given a higher dose, or she did not notice that the patient is allergic to a particular drug and she gave that drug to the patient got an anaphylactic shock. So this is a serious or an untoward incident. Okay. Never event is like a sponge or a mop was left behind in the abdomen, and without taking the mop count, the abdomen was closed. So this is something which is a never event. Okay, so these are the type of events that require incident reporting. Now, how do you report the incident? So basically, it can be web-based or you can have a pro forma for that. Who can do the incident reporting? So anybody can do. You need not necessarily be a part of the incident. You have just witnessed the incident. You can report it. Okay. or somebody told you, okay, I saw an incident that had happened. You have not seen that incident happening, but you have heard about that incident. So you can report it. Now, when do you report it? So ideally, these forms, they should be reported as soon as possible, because at that time, it's clear in your mind whatever has happened. Okay. And they should be reviewed by the person. The risk management team, they have to review this incident report ideally within 24 hours and not later than 7 days after the incident. Okay. Now, to whom do you report the incident? So you will report it to the head of risk management if it is during office hours. If it is out of hours, then the site manager can be contacted, and this site manager, in turn, he will call the on-call director or the senior manager. Okay. So this is all about an incident report. This is a typical form of the incident report, but each hospital will be having a different form. So you can see here that it is the name of the person who is making the incident, what is your job title, who is your immediate supervisor, what is your employment ID, then the department that you are working, and most importantly, the date on which you are making the incident report. Now, remember, this can be different from the time when the incident happened. Okay. Then when you are writing the incident details, the date when the incident happened, the time of the incident, and the exact location where it happened. So don't write it happened in this hospital. In the hospital, in which department, in which room, whether it took place in the labor room or in the operation theater or in the clinic, you have to be very precise about the location. Now, were there any other persons who were there, who were witnesses for the incident? The description of the incident. Okay, so just describe the incident in detail. You do not have to write your own thought process that this should have been done or that should have been done. No, whatever happened, write that exactly in the chronological order. What were the immediate actions that were taken, and root cause of the investigation that you do not have to write. It would be done by the risk management team. Okay, and then you have to sign. If your supervisor is there, your supervisor will also sign this, and then you have to submit it to the risk manager. So in the lower part, you can see it, the name of the person who has received your incident report, the date, and the signature. So once it has been received by the concerned person, then your incident reporting is complete. Now, supposing depending on the grade of the incident that has happened, the risk management team will decide whether this particular incident requires a root cause analysis. If they notice that these incidents are repeating, there are a large number of incidents of these happening over a certain period of time, then an audit is done. Okay. But if it is just a one-off incident, then a root cause analysis is done. So what is a root cause? A root cause is a certain failure in the process that, if eliminated, would prevent an adverse incident occurring. Okay, like I told you, if the nurse had properly noticed that this patient is allergic to a particular drug, if it was properly documented in the patient's notes, or if the patient was given a band, okay, saying that this patient is allergic to this particular drug, then the nurse would have been more vigilant and she wouldn't have administered the drug to this particular patient. So the root cause is that it was not documented. Now, why it was not documented, that is what you have to find out. Okay. So in your exam, you would be given an incident that has happened. Okay. And you would be told to make a root cause analysis. So how do you go about it? So the first thing is you have to make a summary. Remember that whenever you are making a summary, it has to be in the form of S bar. That means the situation, background, what is your assessment, and your recommendations. So once you have summarized the incident, then to make a root cause analysis, you will not be the only person who is making a root cause analysis. There has to be a team, or there has to be a committee, or there has to be an investigation team. So who all would be there? Obviously, you will be there. Your consultant would be there. You can also involve in consultant anesthesiologist. There could be the senior midwife or the senior nurse and the hospital risk manager lead. All of you will constitute the team. Then, and to know what exactly has happened, you have to gather data. So from where can you gather data? You can go back to the notes of the patient. You can conduct interviews. All the people that who were involved in the incident, you can interview those people. Okay. And you can also see what are the protocols that they have followed. So in this way, you will know what exactly has happened. Now, how did it happen? So for this, you have to determine the chronology. Okay, now when you are determining the chronology, please remember that it is not like you are trying to blame somebody. Okay, you have to focus on what exactly happened. You are trying to solve the problem and you are not trying to blame anybody. Okay, now once you know how it has happened, why did it happen? So you have to establish the cause and draw conclusions. So to find out how it happened, you have to identify care delivery problems. Like some unsafe acts are there, like the nurse or the doctor, they did not act, they failed to act, or they took an incorrect decision. You can also identify contributory factors. So patient factors, like there was existing, like the patient was highly morbid, or something gone wrong during the surgery. So there were a lot of adhesions, or in cases of postpartum or antepartum hemorrhage, whether the patient was a Jehovah's Witness. Okay. There could be problems with the doctor, personal problems, like the doctor was fatigued too much, there was too much of stress, or there were some social factors. Communication, like improper communication, whether it is a verbal or an oral communication. Then task factors, like whether all the guidelines that are there in the hospital, are they up to date? Are these guidelines being followed? Are the guidelines easily accessible to the doctors? Okay. Like there are good diagrams, there are good charts. Then risk management tools or risk assessment tools, are these easily available? And lastly, the training of the doctors. Okay. Is there adequate training? And are the doctors or the nurses, are they working under supervision? So once you have made a note of all this, then you can come to your conclusions. Now, after you have made a conclusion, you have to make recommendations. So the recommendation would be like either you have to change a certain practice that is being followed in the hospital, or maybe the doctors and the midwives, they need more training. Now, it's not enough that you make the recommendations, okay? You have to follow up, or you have to close the loop, or you have to share the lessons learned so that everyone is aware of all the mistakes that have happened and how you are going to correct the mistakes. So how do you share the lessons learned? You can have a group, and at the group level, you can have a meeting with the staff, or you can put up a newsletter and you can tell them the recommendations that have to be made. At the hospital level, you can have a newsletter, or you can have internal safety alerts. Then to implement the changes, you can have a session, you can have meeting with all the stakeholders, and you want to monitor whether these implementations are taking place or not. So you can have regular reviews of all the practices that are being followed, whether the recommendations that you have made, whether they are being implemented or not. And then after 6 months to 1 year, you can have a review to see whether the practices have been changed or not. Okay. So this is how basically you are going to do a root cause analysis. So this is just in a tabular form how you are going to do the root cause analysis. So the first thing is collect the facts. Now, to collect the facts is what happened, who is the staff involved, any witnesses that were there, what is the physical or the observed evidences, whether there are any pictures that are there, any photographs, the records, documentations, and the medical facts of the case that happened. Then after you have collected the facts, you have to analyze what happened. So how did it happen, the causal factors, the chronology. Now remember, every time here, please do not focus on blaming an individual. Okay, this is something, a root cause analysis or an incident reporting is something that we are doing to solve a problem. We are not here to blame an individual. Okay. Then once you have analyzed the fact, you have to establish the cause, draw conclusions as to why it happened, what are the probable causes. You have to validate the conclusions and make recommendations. Now, after you have made recommendations, you have to make sure that the recommendations are implemented. There should be someone who is going to monitor whether these changes are taking place or not. You have to review it, and then you have to also give a time scale in which the review is going to be done. Okay. So these are basically the differences between an incident report and a root cause analysis and how you are going to do that. Thank you so much for watching the video, and I hope it was helpful to all of you. I'm sure all of you are studying hard, so good luck for your exams, and I'm sure all of you are going to do well. Thank you once again for watching. Bye-bye. Take care.